Hi, I am Jill Jordan, and this is my video reflection on healthcare informatics. So the first question on this assignment is, what experience have you had with healthcare informatics as a professional or clinician? Well, at this point, I have not had too much experience as a healthcare professional or clinician. I'm still looking to gain that, preferably this summer. But the only related job that I've had is when I was a medical assistant for a school district summer school 2 summers ago. And there were 3 buildings being used for the summer school, but only one nurse, so I was hired as the assistant. The nurse would spend all day at the middle school, and I was at the high school. I performed basic tasks like taking temperatures, administering medicine, and bandaging small wounds. And in this job, I used a program called Snap. So that was just online, and I logged all the information about why a student came into the office and like what we both did while the student was there. So the app is just a tool for school nurses to keep track of student health. I could print it out and give any information to parents if I needed to, or I would just have the information to refer back to if a student came in again a different day. And also it would allow for the nurse to review everything I did just to make sure that everything was still on track. So this tool, Snap, is really the only professional experience I've had with healthcare informatics so far. The second question of the assignment was, what experience have I had with health informatics as a patient? As a patient, I think I've probably had pretty much experience with healthcare informatics. But one example is just most of the time when I'm receiving healthcare, it's through Mercy Hospital in St. Louis. And they have an online patient portal called My Mercy, which I signed up for. And there's many things I can do on this portal. Just a few of them are look at test results. I can view my health history and history of like medications I've taken and things like that. All of my Mercy providers manage the information in this portal, so I can access all the information anytime I need it, and I think that's a very beneficial tool. The third question is, have you ever participated in telehealth? If yes, what were the benefits or the downfalls? So my answer with this, I'm kind of building off the answer to question number 2, because I kind of consider the My Mercy portal as telehealth. Like I mentioned, that was an online tool where I can get information about my health or contact my doctors too. Benefits are that it allows for quick and easy access because I can get the information anywhere as long as I have my phone really or a computer. However, I have not taken part in the part of telehealth that is like virtual appointments. I think there could be benefits and downfalls to this. Benefits would be easy access and access for patients who like maybe don't have reliable transportation. But downfalls could be that personal connections will not be made, and some patients really like that and like value that in their healthcare. And then another downfall I thought could be that the doctor can't make certain observations about their patients through a screen. So for example, the patient or the doctor could ask the patient to just like describe symptoms and anything, but the patient may not be like thinking of something that the doctor would. Like for example, they can't like really see my skin through a screen or just like see how I'm acting, how I feel. I think for some conditions and like some appointments, it would be really important for the doctor to be able to be physically in the room with you, and so they can just get as much information as they can. So then the fourth question of this is, how has healthcare informatics benefited me? I kind of already mentioned this, but healthcare informatics has really just benefited me by making things quick and easy. For example, I make gynecologist appointments like over a year in advance because I only go for yearly checkups. And I oftentimes forget the date because I never write it down right away. But that is not really a problem because the date of my appointment can easily be found in my Mercy account. So yeah, they always happen in around March or April. So I know I just need to log in when those months come around. I can see the date and I don't have to worry about missing it. And then additionally, whenever I need to refer to my health history or like immunization history or something, it's so quick and easy to sign in and get all that information. An example of how this has been beneficial is that I work for a babysitting company based out of St. Louis. And once we confirm a babysitting appointment, we're not allowed to cancel unless we have a doctor's note. Well, I had a scheduled sit for March, and I had scheduled it before the coronavirus really blew up. Well, I have asthma, so I did not really want to leave my house to go babysit for a family I had never met before. But I didn't have time to go in and get a doctor's note or anything, especially because with coronavirus going on, doctors are saying, like, don't come in unless it's an emergency. So I was really stressed out. I didn't know what to do. And then my mom said, well, maybe if you can prove to them you have asthma, they'll work with you. So luckily, I could access my health history online, and I just took a screenshot of my portal that said I'd been diagnosed with asthma early on in life and that I've been treated for it all throughout my life. I sent that to my employer, and it really helped me a lot. They worked with me, didn't make me go to this appointment. They found someone to take my spot, and since it was reliable information that came from my medical providers, they just believed me and worked with me a lot. So being able to do that quickly and effortlessly benefited me, benefited the company I work for, and the family that needed a babysitter. But overall, it's just, I think healthcare informatics saves time and is just overall very efficient. So the fifth question is, what downfalls have I seen with healthcare informatics? I have not personally experienced any downfalls with healthcare informatics, but I obviously imagine there could be some issues. I feel like a big part of modern healthcare informatics is telehealth and electronic records. So I mentioned some downfalls to telehealth about like the doctor not being physically with the patient in an earlier question, so there's that. But there could also be issues with reliability and security in these things. For reliability, people may not have stable internet access, so they can't access their records, or the appointment with the doctor will break up, or things like it'll just have bad quality. And then for security, if patients' information can be accessed on the internet, people may be able to somehow like hack in and get information that they really shouldn't be. Probably all these like electronic health records and things like that are online have like really good and strong security systems. But I mean, there are smart people in the world. I think there could still be ways to get around it, and a lot of bad things could come from that if it ever happened. So then the sixth and final question is, what type of healthcare informatics have I seen to be the most impactful for a patient to comply with treatment? Like I previously mentioned in the first question, I don't have a lot of experience with healthcare informatics as a professional, so I can't really say what type I've seen be most impactful for patients to comply with treatment. However, like I talked about a lot in this video, any online healthcare informatics is what I think is most beneficial. I'm not sure if it exists yet, but I think it would be smart for healthcare organizations to make their portals into apps, and then those apps can in turn send you reminders, and I think that would really help patients a lot in their treatment. They can remind you when you have an appointment coming up, when you need to take your medicine, when you need to do physical therapy, many different things. And getting that notification right there to your phone, and you don't just have to remember it in the back of your head, I think would make a patient a lot more likely to be consistent, get it done, and then they will get the best results. But yeah, overall, I think healthcare informatics is really great. It's very broad. I think I really focused on telehealth and electronic health records and stuff in this, but healthcare informatics can be anything used to manage healthcare. I just focused on mainly my personal experience, but yeah, that's all. Thank you.